السلام عليكم ورحمة الله وبركاته. الحمد لله. بسم الله الرحمن الرحيم. اللهم صل على سيدنا ونبينا ومولانا محمد وبارك وسلم. Jazakumullah khair, Shaykh Rizwan and Dr. Sanu. MashaAllah, very inspirational. And hopefully we can take some of the advice that they have given us, MashaAllah. As our moderator has said here, I want to hopefully try and engage some of the medical doctors here on this panel so that they have something also to contribute and talk about and discuss, inshallah. So at Darul Qasim, which is the institution that I'm at, I founded it, alhamdulillah. We do have a medical group of about 15, 17 medical doctors who work with us on bioethics, and it's a formidable group, mashallah, and we do understand the urgency of Islam and Islamic law when it comes to every issue in life, especially now with the pandemic and also the virus. So I'm going to talk to you straight up about this and see if we can help each other and understand how I think Islamic bioethics should be, inshallah, implemented in this pandemic. Well, let me see if I can share the screen. Where's the screen here? Yeah, this one, right? This one. So this is Islamic jurisprudence and pandemics. What we feel.
Dr. Sheikh Amin, we could not see your screen. Can you share screen and then point to your PowerPoint? You have to open your PowerPoint, then share. Yeah. Okay.
Now
yes, now we got it. Thank you.
Great. Oh, wonderful. Technology does work sometimes. MashaAllah. Alhamdulillah. So I just want to say as a preamble that in matters of taqleed, we don't follow Abu Hanifa necessarily in the furu', in the subsidiary conclusions. We follow Abu Hanifa only in his usul and in his methodology. That's what the madhab is. So we still need his usul because we're not, I don't think any of us is smart enough to go into the nusus and recreate usul for ourselves. Those usuls are of two types. One are those that are contextual, and the second are those that are contextual. So when we use the contextual qawaid, secondary considerations, then we are able to use that for dispensing, right, using the medical term, dispensing a fatwa, which is very different from the actual hukum in the madhab. So in times of need and pandemics and desperation, a mufti is allowed to give you a fatwa where he's going to consider what Dr. Sanu and Shaykh Rizwan was saying about the maqasid, so that life is facilitated. But that doesn't mean to say that's the actual rule in Islam, because the actual rule in Islam takes an ideal. What is the ideal in Islam? That we say, look, what is the ideal in pork? What is the ruling on pork? What is the hukum on pork? It is haram, period. If, God forbid, there's a situation where somebody's dying and he needs to eat a little bit of pork, غَيْرَ مُتَجَانِفٍ لِإِثْمٍ, without going towards sin, then there will be no sin on him. فَلَا إِثْمَ عَلَيْهِ, there will be no sin on him. But it doesn't change the hukum. The ruling on pork still remains that it is haram. In this contingency, which is allowed for that one particular person to consume enough so that it saves his life. So there's a difference, I think, between what we believe is the hukum, the ideal ruling on an Islamic issue or any issue, and what is a contingency and what is dispensed as a prescription for the person in situations. So we must make a distinction between the two if we're going to progress. And I'll try and give you examples. In this pandemic, there's the issue of, say, many Muslims who are Hanafi, right? They are doctors. These are doctors in the trenches. They're dealing with COVID-19 patients day after day after day. And some of them were a bit concerned that the hospital administration may ask them to shave their beard because the mask is not fitting, or there's a certain, danger if they have a beard and so on. So there, I think that the way we need to address this is that, first of all, let's rethink how we frame the question. One is what we call here a reactive approach, that I am being asked and forced to shave my beard, otherwise I can't do my job. That's a very reactionary approach. The proactive approach would be to frame the question differently and say, look, I'm a Muslim, I want to practice the Sunnah, I love the Prophet Sallallahu Alaihi Wasallam. Can you give me a suggestion as to what I should do without غَيْرَ مُتَجَانِفٍ لِإِثْمٍ, okay? Without conceding sin? And that's why I framed a phrase here in our bioethics: first do no harm, and then with a Muslim, first do no sin. No harm, no sin. They go together in Islamic bioethics. So that should be at the top there, where you understand and appreciate our philosophy towards Muslim and Islamic bioethics, is that we have to ensure that we are in line with the maqasid, the objectives, but we're also in line with the akhirah, because you cannot detach the akhirah when you talk about Islam. And that is why we have the distinction between what is contextual and what is acontextual. Now, Islam considers contingencies as part of its legal structure. Okay? So there are rukhas, okay? There are concessions that Islam gives, that if you're in Ramadan and you're sick, you're not able to fast, then you may not fast. وَمَنْ كَانَ مَرِيضًا وَعَلَى سَفَرٍ فَعِدَّةٌ مِنْ أَيَّامٍ أُخَرَ. That is included in the body of jurisprudence. You don't need to go outside of the body of jurisprudence to get that concession or dispensation. Now, as new cases arise in this pandemic, and it's a very novel situation, and I agree that in this case, there perhaps is not, to Dr. Sanu's point, that I don't think there's a maqis alayh here. I don't think there's a precedent in Muslim history for this pandemic. I think this is a very novel situation, and we must use every tool available to us to come to certain solutions. But the solution should be considered only as twofold. One is a contingency plan, that you dispense a fatwa. In this case, it is allowed. That is at the micro level. What I want to talk about today is the macro. What is the macro approach of the scientific community towards curing and healing? And that's where I believe that we need independent thinking and we need creativity. We need to do just more than, say, concede to the status quo and then let people just live their lives assuming there's no alternative and there's no halal solution. And for that, confident Islamic knowledge and tradition is must, and halal means for healing are best for people universally. So I'm going to give you a few diagrams here, a few charts here that you can look into what is now happening in the Muslim world outside of the pandemic. As I said, is a novel situation, and we will address that, and we are addressing that as we speak, and even in the future, inshallah. But I want to step back and go into the micro thinking. The philosophy of Islamic medicine is that what can a scientific community do as Muslim physicians to make halal available? Okay? If there's a halal alternative, or if there's no immediate halal alternative, then what do we do at the philosophical level? What do we do at the epistemological level? What do we do at the state level to make sure that we allow Muslims to consume halal? Just as it is binding on a government to develop the infrastructure for halal jobs and halal earnings, Likewise, it is binding on the Muslim government to develop an infrastructure where there is halal sources and means of cure and healing. So here in this first one, you see, it's very, very clear. These are ideals, by the way. Okay? So what is the current practice? Embryonic stem cells. Is there halal alternative? Well, in the industry, there is possibly a halal alternative, adult stem cells. And what is that? As you see on the right column, that we will now be using live stem cells from the person himself or herself, and that will make it very, very halal. So we don't need to ask the question, is embryonic stem cell halal or not? Because that's a defeatist attitude. If there is a vaccine which only has halal ingredients, and you have another vaccine which has haram ingredients, then there's no reason why you should use the haram vaccine. It makes no Islamic sense, okay? As you see here in the kidney transplant. So these are, as I said, ideas. They may or may not correspond to what is the status quo in the medical field at this moment, but you can say that you don't need to illegally harvest human organs. Why are you asking the question, is organ transplant halal, when you haven't looked into the idea of providing a halal alternative in the first place? But that comes down to the governments. That comes down to the medical community and the scientific community, that they need to think creatively beyond acquiescing to the status quo. That the industry has provided us a means of cure, and sometimes, as you know, with organ transplants, there are complications post-op, which perhaps may define what's it called, the utilitarian view of fiqh. That the fiqh is based on some kind of utilitarian approach where, okay, if you say that, then what's the utility of understanding the post-op complications of organ transplant? And you have to put that into the discussion also. So now there's that. And so now the second one, you'll see, maybe even some more, what do you call it, examples as how we in this group try to understand that we are at the forefront here in the USA. The amazing scientific and medical talent that the Muslims have in the US and in the world is mind-boggling. It is stupendous. We have doctors who run hospitals. We have on this forum at Darul Qasim doctors who are the cream of the crop in their profession. They don't need to acquiesce to the status quo, and they don't need to be defeatist. They can be creative. They are intelligent. They're smart. All it needs is somebody to say, okay, I'm going to fund you, and let's see if we can find a halal alternative where we do not ask the question, is this halal or not? Because that question itself is defeatist. In the macro, I'm not talking about the fatwa on the ground as today. Obviously, if somebody's dying and he wants an organ transplant, or if he wants a blood transfusion, the mufti is not going to say, kill him. He's not going to do that, because that's a contingent. That's a dispensation. It's a pill. It's a prescription, but it's not the hukum. It's not what we as Muslims are looking for. Muslims have to go a step beyond what's available in the market, what's available in the industry, and then realize that we do have a responsibility, both as a jurist and as a medical scientist, to provide halal from the get-go, and from the very beginning, that we must think this way, that we are responsible for providing halal medicine and halal means of cures, instead of going reactionary to the mufti and say, this situation, what can you do? The mufti miskeen, he's going to say, my hands are tied, you want to save your life, and Dr. Sanu and Shaykh Rizwan, what's his name? Sorry, I'm getting your name wrong. I don't want to. Rizwan, there you go. They say that the priority is with life, the priority is not with deen, which is understandable. But as perhaps the macro, The science behind it and the legal jurisprudence behind it demands that Muslims go forward. And they simply do not give in to the status quo. And they look at this, smoking. Right. So you have smoking. So what can you do with smoking? That if there was jurisprudence and fiqh, and then the doctors got together and they started advertising the harms of smoking in Muslim communities, that would make a tremendous impact and a difference to the number of lung cancer patients and the number of other the complications you see there on there. But that requires a community effort. That requires a different mode of thinking. That requires that you're thinking that preventive measures are much better than trying to cure something after the fact. So this is how I think we need that liver transplantation. Yeah. So this is something that is universal. Smoking is a universal problem. Okay. Alcohol is a universal problem. And most cases that come for the liver complications are based on consumption of alcohol, etc. So as you all know, much more than I do. But if you were to lead a campaign from the Amr bil Ma'ruf wa Nahy anil Munkar perspective, that we are also obligated by the Quran to prove the Ma'ruf in not drinking and to prove the Munkar in drinking. And that is our responsibility as an ummah. And everybody who has a stake with this ummah should consider that they must do something, whether through advertising, whether through education, whether through testing, whether through data, whether through utilitarian, studies, whatever it takes. We have to drive the point home that we cannot allow society to kill itself just because somebody wants to have fun, because then you face the consequences. And the consequences that you get into this idea is now liver transplantation, is that halal? But you haven't addressed the cause. You're addressing the symptom. And the symptom is that the mufti, as I said, will say, fine, if that's what you have to do, then that's what you have to do. But what does that mean for the society? What does that mean for the governments? What does that mean for the medical community? The medical community has to come up with a safe standard of life so that they are engaged with Muslim thinking. Okay? We are independent. We do have an independent philosophy. We have civilizational values based on the millah of Ibrahim alayhi salam, based on the ummah of Muhammad sallallahu alaihi wasallam. These values are superior. So in this pandemic, one of the issues that came up is washing. Washing hands constantly, frequently. And all the Muslims I talk to, they say, it's a joke. Muslims, they have to wash their hands at least 5 times a day. When they use the washroom, they're washing their hands. So a Muslim invariably is washing hands 10 times a day because of the universality of our hygiene, the oral hygiene, the personal hygiene, the hygiene of the place where you pray. These are all the sharait of salat. These are all the prerequisites for salat, meaning we can't go into ibadah without being this clean. This has to be promoted as a civilizational value. And when we come into contact with people, we tell them this is what we do as Muslims. We've always been raised to think clean. We are hygienic. And there are so many references in the Ummah of the past. And you look at Muslim Spain, you look at Turkey, you look at other places in the world, and you'll see nothing except hygiene in the culture. It's all hygienic. And we must appreciate this, that we should be on the offensive, not on the defensive, when we're promoting Muslim Islamic bioethics, because it is superior. And we must share this with other people. But the only way you can do that is if you think that way. If you don't think that way, you're not going to get there, because you've already acquiesced, resigned, submitted, to use the word Islam, you submitted to the status quo, and you're saying to everybody in the world that this is the only solution we have. And I say, no, that is the last resort. It's not the only solution. And finally, you'll see this one, very clear and very obvious here, the porcine heart valves. We don't need them if there's a halal alternative. And this example of this drug here, heparin. So I was there in some country talking about Muslim bioethics, and they could not, for the life of me, see that for generations they've been using this drug, knowing that there's a halal alternative just because they weren't thinking Muslim. That's where the akhirah ties in with the jurisprudence. That if there's a halal alternative to this drug, why are you dispensing this haram? You don't need to. There's absolutely no need. There is no jawaz in fiqh for you to do that. That you have here chicken and you have here pork. So just because the pork is available doesn't mean to say we're going to overrule all our qawaid and all our maqasid and all our rules of fiqh and say, no, in this circumstance, because there's a contingency, you're going to go with the pork even though the chicken is available. That is ludicrous. Yeah, you can't do that. And on the pancreas transplantation, you see that on the graph there, and you see the heart transplantation. So what I'm saying in principle, that at Darul Qasim, when we study Islamic bioethics, we want to make it purely Islamic, that is based on a philosophy, is based on a model, is based on a paradigm, is based on our epistemology, so that we get to understand what is the ideal hukum for the state, for the Muslim Ummah, irrespective of contingencies. Contingencies we already accommodate by default, because those are contingencies. That's part of law. So we don't need to really beat the drums of maqasid or beat the drums of whatever legal expediency. What we need to do now in this pandemic, and perhaps as a result of this, is come together on one platform as medical scientists and jurists so that we can define for the ummah that this is a viable halal treatment and cure and healing process for these illnesses and diseases, as the Prophet ﷺ said, that Allah subhanahu wa ta'ala, when he sends down an illness, he sends down with it a cure. It is up to the Muslim scientist to go and look for the cure. He has to be proactive. He has to use his intelligence. And as I said, some of the panel members here, they're also in the USA, and they understand exactly the genius that we have within Muslim physicians in this country. They are smart people. They can do this. They don't need to think outside of the box. They need to expand the box. Make the box bigger so you include what is halal in your dispensation, as you unfortunately have to resort to haram when you don't find a halal alternative. And that is my sincere advice, and hope that we all come together on one platform and try to understand that we as an ummah, kuntum khayra ummah, ukhrijat linnas, ta'muruna bil ma'ruf wa tanhuna 'anil munkar. The ma'ruf is halal, the munkar is haram. We cannot allow people to be defeatist and reactionary and say, no, when you go back to work today or tomorrow, you're going to dispense that haram pill or procedure or whatever, because you don't have an alternative. That is fine for the moment. At the micro level, it's not fine at the macro level. At the macro level, we are burdened by Allah subhanahu wa ta'ala, and we are held responsible to show the world that we have ma'ruf and we have munkar. And unless we start thinking this way as an independent body of scientists, where we're not even considering what's out there in the community or in the medical field. It should be totally abstract and totally independent of all other models and paradigms, and you will be surprised as to how these wonderful scientists in this country and other places in the world too come together, and you will find a cure that is purely halal, where you don't need to go to the mufti and ask him, is this halal or not? We should get rid of that attitude totally, because modern day medicine makes my life very difficult. Because you're always promoting haram in front of me. What you do is, this medicine is haram, this medicine. What do I say? You're going to save a life. Bismillah, save the life. You see that? But before, when Muslims were careful as to how they manufacture medicine and what kind of idea and philosophy they bring to the table for healing and cure. Allah subhanahu wa ta'ala is the Shafi. Allah subhanahu wa ta'ala is the one who heals, He's the one that cures. We have the perfect role model in Isa alayhi salam. Muslim doctors and non-Muslims doctors, they can't do what Isa alayhi salam did. What Isa alayhi salam did is that he revived the dead. That's in the Quran. Whether you make ta'wil of that, it doesn't matter. But what I'm saying is that we have a perfect role model. That in medicine, in the Quran, that they have hidayah, the prophets are role models. And when we look into the Quran, we find this role model in Isa alayhi salam.
Which to get back?
He'd find medical practice for us Muslims today. And if you want to have a role model for the patients, so the hospital has obviously doctors and patients. Then you have the role model of Ayyub alayhi salam. Ayyub alayhi salam is the perfect role model for patients. All I'm saying is that when you find guidance in wahi, then you must use that as an asl. You must use that as a foundation. You must use that as a launching pad and go with it. Bismillah. And I think the more that we promote this idea, I think the more confident we will gain and the more we will be in line with what is traditional Muslim thinking, and that is kuntum khayra ummah. You are the best nation, and the proof is in the pudding. Sorry to excuse that.
Thank you very much, Shaykh Amin. Thank you for sharing your bioethics knowledge.